The most outstanding contribution of epidemiology is the study of association and causation in health and disease. And ironically, the most difficult part is to tell whether an observed association represents a cause and effect relationship. Good day. Our objectives for this session are as follows. Explain the concept of cause, differentiate between sufficient and necessary cause, causal versus non-causal association, direct versus indirect causal association. Explain the different criteria used in establishing causality and apply the criteria for causality in given scenarios. In August 6 of 1945, during the final stage of the Second World War, the United States dropped atomic bombs, codenamed Little Boy, on the Japanese cities of Hiroshima and Nagasaki, which killed at least 129,000 people. An epidemiology study by the Radiation Effects Research Foundation states that from 1950 to 2000, 46% of leukemia deaths and 11% of solid cancer deaths among the bomb survivors were due to radiation from the bombs. Among the observed birth defects was a higher incidence of brain malformation in these places, including microencephaly and anencephaly, an increase in stillbirths, birth defects, and infant mortality. As late as 1985, chromosomal aberrations in somatic cells persisted among the exposed survivors. During the Vietnam War from 1961 to 1971, Agent Orange was one of the herbicides and defoliants used by the U.S. military as part of its herbicidal warfare program, known as the Operation Ranch Hand. Spraying of the herbicide was usually done either from helicopters or from low-lying C-123 provider aircraft, which were fitted with sprayers. The goal was to defoliate rural or forested land, depriving guerrillas of food and cover, forcing them to flee to the U.S.-dominated cities. Herbicide Orange got its name from the color of the orange-striped barrels in which it was shipped. It is a mixture of equal parts of two herbicides, 2,4,5-T and 2,4-D. The 2,4,5-T was contaminated with 2,3,7,8 tetrachlorodibenzodioxin, or TCDD, an extremely toxic dioxin compound known to be carcinogenic to humans. Three studies have suggested that prior exposure to Agent Orange poses an increased risk of acute myelogenous leukemia in the children of Vietnam veterans. In the 1970s, high levels of dioxin were found in the breast milk of South Vietnamese women and in the blood of U.S. military personnel who had served in Vietnam. They had increased rates of nerve, digestive, skin, and respiratory disorders. In particular, higher rates of throat cancer, acute or chronic leukemia, Hodgkin's and non-Hodgkin's lymphoma, prostate cancer, lung cancer, colon cancer, soft tissue sarcoma, and liver cancer. Lifestyle risk factors including dietary habits, physical inactivity, and adiposity, and smoking strongly influence the established cardiovascular risk factors. Epidemiologic studies have shown that a personal and family history of colon adenomas places one at an increased risk of developing colon cancer. The mutation of the adenomatous polyposis coli gene, or APC gene, causes adenomatous polyps in the colon, which is the precursor of colon cancer. So what is a cause? It can be an event, a condition, or a characteristic, or a combination of these, which plays an important role in producing the disease, in producing a regular or predictable change in the occurrence of the outcome. Logically, a cause precedes the disease. Necessary and sufficient causes are examples of deterministic causality. A deterministic model of causality claims that a cause is invariably followed by an effect. A necessary cause must always precede a disease or effect, and it must be present for the disease to occur. For example, the tubercle bacillus is necessary for tuberculosis to occur. Etiologic classification of diseases often produce necessary causes. Sufficient cause refers to the multitude of individual circumstances that must exist or occur in sequence for the effect or disease to follow. It inevitably initiates or produces an effect or disease. It may include component causes, as in the sufficient component cause model expounded by Rothman. By component causes, it means together they constitute a sufficient cause for the outcome in question. In communicable diseases, for example, this may include the biological agent as well as environmental conditions. For example, in TB, measles, rheumatic heart disease, and foodborne infections. In non-communicable diseases, this may include a whole range of genetic, environmental, as well as personal or psychosocial behavioral characteristics, that is in diabetes, cancers, and ischemic heart disease. The causal bacterium for tuberculosis is the tubercle bacillus, which is a necessary cause of tuberculosis. This means that in order for one to develop tuberculosis, one must become infected with the bacterium. However, exposure to the tubercle bacillus is not a sufficient cause for contracting tuberculosis. A number of component causes such as personal and environmental factors operate in addition to the exposure to the bacillus in order to cause tuberculosis. These additional component causes are not necessary causes. One component cause complex might include crowding, sanitation, nutrition, and immune status. The Broad Street cholera outbreak in 1854 is best known for Dr. John Snow's study of the outbreak and his discovery that cholera is spread by contaminated water. In the mid-19th century, the Soho district of London had a serious problem with filth due to the large influx of people and a lack of proper sanitary services. Many cellars had cesspools of night soil underneath their floorboards. Since the cesspools were overrunning, the London government decided to dump the waste into the River Thames. This action contaminated the water supply, leading to the cholera outbreak. By talking to local residents, Snow identified the source of the outbreak as the public water pump on Broad Street. Although Snow's chemical and microscopic examination of a sample of the Broad Street pump water was not able to conclusively prove its danger, his studies of the pattern of the disease were convincing enough to persuade the authorities to disable the well pump by removing its handle. Snow used a spot map to illustrate how cases of cholera were centered on the pump. Snow's efforts to connect the incidence of cholera with potential geographic sources centered on creating what is now known as a Voronoi diagram. This is an electron microscope image of Vibrio cholera, the bacteria responsible for the gastrointestinal disease cholera. In order to get the disease, the bacteria must be able to colonize in the small intestine, and a crucial factor necessary for this colonization is the toxin co-regulated pilus. In non-communicable diseases like coronary artery disease, lifestyle risk factors, including dietary habits, physical inactivity, smoking, and adiposity, strongly influence the established cardiovascular risk factors, which eventually affect novel pathways of risk, such as inflammation or oxidative stress, endothelial dysfunction, thrombosis or coagulation, and arrhythmia, which are necessary for coronary artery disease to occur. The word association refers to linkage between and among variables. And in epidemiologic research, the following are possible associations among variables. If there is a statistical association between or among variables, is it likely to be causal or not? If causal, is it direct or indirect? The basic requirement for a causal relationship is the existence of an association between the presumed cause and the outcome of interest, be it death or disease. The outcome is significantly greater or lesser among those exposed than unexposed. So when it can be proven that a change in the independent variable or exposure produces, induces, results in, leads to, determines, or causes a change in the dependent variable or disease, then it is more likely to be causal. If non-causal, the association could be merely a one-time observation due to chance and random factors or due to errors in the methods and procedures used. The association may be statistically significant, but the presumed cause occurs after the effect, or there is some other factor responsible for the presumed cause and presumed effect. And if the association is causal, the causal pathway may be direct or indirect. If A causes D and D causes B, there will be a causal relationship between A and B, but the association may be thought of as indirect since it operates via two other causal relationships. Example, in pre-penicillin days, syphilis was treated by intravenous injection of salvarsan. Jaundice was a common complication of this treatment and was known as salvarsan icterus. It became evident that the icterus was associated not with the salvarsan, but with the use of inadequately cleaned syringes. Poor syringe hygiene then became the direct cause of the disease. Further investigation revealed that the responsible agent was not simply the uncleanliness of the syringes, but the presence in them of minute amounts of human serum remaining from previous use. The disease became known as serum hepatitis. Later, it became known that the hepatitis was associated directly not with the serum, but with the presence in the serum of hepatitis B virus. Thus, the association with the virus became considered the direct one, and that with the serum the indirect one, resulting in another name change from serum to viral hepatitis B. Further studies may reveal what specific attributes or molecular components of the virus might be considered more direct causal factors of the disease. A direct causal association occurs when the factor under consideration exerts its effect without intermediary factors. An indirect causal association occurs when one factor influences one or more factors through intermediary variables. Other factors in causation can be classified as predisposing, enabling, precipitating, and reinforcing. Predisposing factors are those that prepare, sensitize, condition, or otherwise create a situation, such as level of immunity or state of susceptibility, and these factors are age, sex, and previous illness. Enabling factors assist in the development of the disease or assist in recovery from illness or in the maintenance of good health. These are income, nutrition, housing, availability of medical care. Precipitating factors are associated with the definitive onset of a disease, illness, accident, behavioral response, or course of action. Examples are exposure to a specific disease, amount or level of an infectious agent, drug, physical trauma, personal interaction, occupational stimulus. Reinforcing factors are those which aggravate a disease or state once this is already present, such as repeated exposure, work, and deprivation. In order for there to be a causal association between an exposure and a health outcome, several criteria known as the criteria of causality must be demonstrated. And so causal inference is the process to determine whether the observed associations are likely to be causal or not. The earliest of this is that presented by Robert Koch. Four criteria were designed to establish a causative relationship between a microbe and a disease. The postulates were formulated by Robert Koch and Friedrich Lofer in 1884 and refined and published by Koch in 1890. Koch applied the postulates to describe the etiology of cholera and tuberculosis. These postulates were generated prior to the understanding of the modern concepts in microbial pathogenesis. The first of these is the microorganism must be found in abundance in all organisms suffering from the disease, but should not be found in healthy organisms. The second is the microorganism must be isolated from a diseased organism and grown in pure culture. Third, the cultured microorganism should cause disease when introduced into a healthy organism. And fourth, the microorganism must be re-isolated from the inoculated diseased experimental host and identified as being identical to the original specific causative agent. Anthrax is a skin disease caused by a bacteria known as Bacillus anthracis. This was the first disease demonstrated to meet these rules. For most diseases, Koch's postulate for determining causation are inadequate since there are many causes and a single factor may be a cause of many diseases. The organism causing the disease may disappear when the disease has developed, making it impossible to demonstrate the organism in the sick person. Koch was well aware that in the case of cholera, the causal agent Vibrio cholera could be found in both healthy and sick people, invalidating his first postulate. Furthermore, there are many viruses that do not cause illness in all infected individuals. And lastly, sufficient microbial data should allow scientists to treat, cure, or prevent the particular disease. Therefore, while Koch's postulate retained historical importance and continue to form the approach to microbial diagnosis, they are not routinely used to demonstrate causality. They have largely been supplanted by other criteria, such as the Bradford-Hill criteria for infectious disease causality in modern public health. In 1965, Bradford-Hill published useful guidelines for determining the nature of an association. This was based on his work with Dahl on the effects of cigarette smoking. These guidelines were used by the U.S. Surgeon General in 1964 to establish that cigarette smoking caused lung cancer. The Bradford-Hill criteria, otherwise known as Hill's criteria for causation, are a group of minimal conditions necessary to provide adequate evidence of a causal relationship between an incidence and a consequence. Hill gives the example of the very large increase in scrotal cancer by a factor of 200 times among chimney sweeps in comparison to workers who were not exposed occupationally to tars and mineral oil. Also called the Soot's wart, it is a squamous cell carcinoma of the skin of the scrotum. It has the distinction of being the first reported form of occupational cancer and was initially identified by Percival Pott in 1775. It was initially noticed as being prevalent among chimney sweeps in their late teens and early 20s who had been in contact with soot since their early childhood. The cancer may be caused by an environmental carcinogen thought to be coal tar, possibly containing some arsenic compound. The strength of the association is measured by the risk ratio or the relative risk and the odds ratio. The higher the value, the stronger the association, the more likely that it is causal. However, a weak association does not rule out a causal effect. Consistency is repeated observation of an association by different persons in different places and populations under different circumstances and times. Also, it is when several studies give the same results. Hundreds of studies have shown that smoking and lung cancer are associated, and no study has failed to show this association. A meta-analysis is a good method for testing consistency. It is a statistical analysis of a large collection of analysis results from individual studies for the purpose of integrating the findings. It summarizes risk ratios or odds ratios from various studies. This is a forest plot of a meta-analysis from summary data available in the Surgeon General's 1964 report on smoking and health. The measure of effect is the incidence rate ratios for death from lung cancer among those with and without smoking. The leftmost portion provides the list of studies. The weights represent the influence of the studies in the overall meta-analysis. The boxes represent the point estimate. The ends of the horizontal bars represent the 95% confidence intervals of the estimate. The diamond represents the overall effect, which is the same for both models, an 11.26 increased risk for death from lung cancer among smokers than non-smokers. Lack of consistency, however, does not rule out a causal association because some effects are produced by their causes only under unusual circumstances. Consistency is apparent only after all the relevant details of a causal mechanism are understood. Even studies of exactly the same phenomenon can be expected to yield different results simply because they differ in their methods and random errors. In a specific association, a given disease results from a given exposure and not from other types of exposure, or one that is constrained to a particular disease exposure relationship. As an example, asbestos causes a specific lung disease known as asbestosis, distinguishable from many other lung diseases. But a low-level lead exposure is associated with lower IQ rather than a specific brain syndrome. Thus, lead is more uncertain as a cause because of possible other causes of low IQ, such as socioeconomic status. In this graph, it may be argued that the association is not specific because the death rate among smokers is higher than the death rate of non-smokers from many causes of death. Hill argued that one-to-one causation is unusual because many diseases have more than one causal factor. Lung cancer can result from smoking or exposure to radiation, asbestos, or nickel dust. At the same time, each of these risk factors can cause diseases other than lung cancer. Smoking, for example, is involved in the causation of heart disease and emphysema. This criterion is easily established and feasible in infectious diseases than non-infectious diseases. Hence, the criterion is not generalized. Temporality is the sine qua non for causality, also known as the antecedent-consequent requirement. It is easier to establish temporality in experimental and cohort studies than in case control and cross-sectional study designs. As an example, seatbelt use has shown an increasing trend since 1994. This is accompanied by a steady decline in the percentage of unrestrained passenger vehicle occupant fatalities during daytime. This time trend is suggestive of the protective effect of seatbelts. This criterion represents a monotonic trend in disease frequency with increasing levels of exposure. That is, more smoking leads to more carcinogen exposure, resulting to more tissue damage and consequently more opportunity for carcinogenesis. Associations that do not show a monotonic trend in disease frequency with increasing levels of exposure are not necessarily causal and may be due to confounding. This is not relevant to all exposure-disease relationships because disease sometimes occur only after a fixed threshold of exposure, and thus a dose-response relationship need not be seen. These graphs show linear relationships between cumulative cigarette consumption and lung cancer death rate. The 5-year death rates from 35 to 39 to 70 to 74 years old were plotted against the cumulative cigarette consumption up to ages 35 to 70 respectively. As indicated by the square of the correlation coefficient, the linear relationships are highly significant, especially for older age groups. In plausibility, an association must be biologically plausible from the standpoint of contemporary biological knowledge. This provides theoretical basis for the association. The biological theory of smoking causing tissue damage which over time results in cancer in the cells was a highly plausible explanation in view of the current knowledge about carcinogenesis. Cesarean delivery as a risk factor for infantile diarrhea finds basis on this biological explanation. Coherence is compatibility with pre-existing theory, factual or biological knowledge, and statistical models. The histopathologic effect of smoking on bronchial epithelium, or the difference in lung cancer incidence by sex, could reasonably be considered examples of plausibility as well as coherence. So there is a very thin or very fine distinction between plausibility and coherence. That hepatitis B infection is a true cause of liver cancer is supported by the presence of serological marker of hepatitis B infection and the finding of viral genome in many liver cancers. Hill emphasized that the absence of coherent information, as distinguished from the presence of conflicting information, should not be taken as evidence against an association being considered causal. The ability of the study designed to prove causation is a most important consideration. Under controlled conditions, modifying the exposure causes a change in the outcome. The best evidence comes from well-designed and competently conducted randomized controlled trials. It was not clear what Hill meant by experimental evidence. Experiments in humans is seldom available for most epidemiologic research questions. Laboratory experiments on animals relate to different species and usually to levels of exposure very different from those of human experience. Thirdly, cessation experiments involve removal of the cause, resulting in significant reduction in disease incidence. From Hill's examples, it seems that what he had in mind was the removal of some harmful exposure in an intervention or prevention program, rather than the results of laboratory experiments. If ethical issues arise or it is impractical to assign many of the exposure, a possible alternative is to remove the exposure and see if the disease decreases. These are the types of study designs and its ability to prove causation. For randomized controlled trials, it has a strong ability to prove causation. For cohort studies and case control studies, a moderate ability, while for cross-sectional ecologic studies have a weak ability to prove causation. Analogy is correspondence between known associations and one that is being evaluated for causality. As an example, thalidomide became an over-the-counter drug in Germany in October of 1957, since its use was noticed against nausea and morning sickness in pregnant women. Shortly after the drug was sold in Germany, between 5,000 and 7,000 infants were born with phocomelia, which is malformation of the limbs. Similarly, pregnant women who had contracted rubella, usually in the first trimester, gave birth to infants with a triad of sensorineural deafness, cataracts, and congenital heart disease. Given that these associations already have been demonstrated, similar evidence with another drug or another viral disease in pregnancy can be judged acceptable to report an association as causal. Any one of the criteria taken alone is not sufficient to demonstrate a causal relationship. The entire set of criteria must be evaluated. Generally speaking, the more criteria that are satisfied, the more convincing is the evidence in support of a causal association. The 1964 report, Smoking and Health, stated that cigarette smoking caused lung cancer in men because the relationship satisfied the majority of the criteria for causality. But some of Hill's criteria, like specificity, were not well defined, and biological gradient is often too strictly implemented, and plausibility and coherence seem to overlap, such that McMahon suggested to consider only three criteria to distinguish causal from non-causal, that is, time sequence, strength of association, and consistency with existing knowledge. For time sequence, for a relationship to be causal, the events are considered the causes must precede those thought to be effects. For strength of association, the stronger the association between two categories of events, the more likely is the association causal. And for consistency with existing knowledge, the evidence that disease distribution in the populations accords with the distribution of the supposed cause. The more extensive the efforts that have been made to identify non-causal explanations of the association, the more likely one is to believe that the association is causal, and a causal hypothesis is supported by invocation of cellular or subcellular mechanisms that make the hypothesis reasonable in the light of current biological knowledge. In agreement with Bradford Hill, Susser emphasized time order and direction to be present for any association that has a claim to be causal. Time order, X precedes Y, direction, X leads to Y. Furthermore, Susser explains that rejection of a hypothesis can be accomplished with confidence by only three criteria: time order, consistency, and factual incompatibility or incoherence. And acceptance or affirmation can be achieved by only four: strength, consistency, predictive performance, and statistical coherence, in the form of regular exposure or effect relation. During April 2016, the Center for Disease Control and Prevention concluded that Zika virus is a cause of microcephaly and other severe brain defects. A JAMA review illustrated the application of Sir Austin Bradford Hill's 9 causal criteria to the relationship between Zika virus and microcephaly. The report showed that 7 of Hill's criteria had been met. Biological gradient was not applicable, and experiment had not been met. Such findings provide early guidance to pregnant women and their partners to take steps to avoid Zika infection, and to healthcare professionals who are talking to patients every day. Thank you for listening. These are my references.